When a patient comes in and arrives, we do all of our 3D planning and diagnostics. We're able to pretty much design everything on the computer beforehand, and then we reverse engineer things backwards to decide exactly where the implant goes. It's wonderful that we have a super specialized lab here at the office so that we can do everything here in-house.
We then use a 3D printer system to print a surgical guide. It has a depth stop, so we know that we're not going to go too deep. It gets the proper angulation so that we know those implants are going to go into the right spot for our restorative needs, but we also know that we're not going to cause any problems with sinuses or nerves or blood vessels.
For challenging cases, you can 3D print an entire exact duplicate off of the CT scan of the patient's real jaw. So you're not practicing on an anatomical dummy, you're not just looking at a screen. You can physically get the same tools you're going to be using and place one of these implants.
If you're sending everything out to another lab, there's just obviously the time constraints. It could take even weeks until you get the final prosthesis. Here it's just a couple days. And because we're in on the planning process at every step of the way, we can make those tweaks cosmetically, functionally, make everything perfect the way that we want it to.
We know those implants are going to be placed correctly. We know that the restoration is going to be just like we designed it. That's why people come to us. We have a reputation for doing things right, for planning things, for using all of the technology that is currently available in dentistry so that the process is predictable.